gentlemen, my name is Dr. Dominic Pimenta, and I'll bring the rest of the panel on and introduce them as we come on. Do come along, guys. Thank you so much to MedTech World for the beautiful venue and the amazing weather. This is our Intelligent Hospital panel. I am Dr. Dominic Pimenta. I'm a pharmaceutical physician and cardiologist. I've worked in hospitals for the last decade, and more recently I'm the founding CEO of Tortoise, which is out of Entrepreneur First in London. Tortoise is a health tech startup which is building the world's first digital physician's assistant, revolutionizing clinical workflows using AI. And joining me this morning is this incredibly impressive panel. We have Philippe Gerwill here. He's a digitalization humanist and futurist who is actually a member of the advisory board at DeHealth and an executive advisor for various other companies, mainly in Europe and Asia. And previous to that, he spent more than 30 years in global roles, mainly in the pharmaceuticals industry. Immediately to my right is Sebhatu. He is a digital health information transformation leader and CEO of DHT, and he's helping to revolutionize healthcare in the German ecosystem and internationally. Next to him is Nina Sesto, is a PhD in molecular biology and MBA from HEC in Paris. Switching from science to business, today she wears two hats. Her family owns one of the largest privately owned cardiovascular centers in the CEE, and she is a co-founder and CEO of MEGI, a startup helping more than 500 million cardiovascular patients to self-manage their chronic disease. On the end here, we have Nadeem Sarwar. He's the CEO of Phlo. Phlo is the UK's largest on-demand digital pharmacy, and Phlo is also the largest provider of API-led pharmacy infrastructure to other health techs in the UK. On behalf of the audience this morning, thank you very much for joining us. Our panel today will consider 4 questions on the subject of the intelligent hospital. What might the future of technology mean for hospitals, what challenges that might leave, and how that will disrupt what we typically think of as hospital and community care. Lastly, we will consider how intelligence can prevent admission to hospital in the first place. To kick us off, my personal view on this topic is that our healthcare systems are fundamentally broken. On the one hand, we have an ever-rising patient demand, with an aging population and ever more complex patients, and 1 in 3 patients globally has multiple chronic diseases. 70% of patients in the US have, 70% of people are on more than 1 medication. We would build something entirely different if we had the technology that we have today in the patient cohorts, and we should be looking to intelligence to help us solve that problem. The field of intelligence, from smart devices to automation to artificial intelligence, as we've just heard, must be the solution. And where Tortoise is focused on is augmenting the fundamental unit of healthcare, the patient-doctor relationship, with AI, making doctors better doctors and making patients better patients. The scale and urgency of this problem cannot be underestimated, but COVID has begun to catalyze this change into reality. And then we've heard a lot about how that's happening today. So, without further ado, to our first question, what might the intelligent hospital of the future look like? Philippe.
Thank you very much for the question, and I'm maybe already going to start to be provocative. I want to change the title. I prefer the smart hospital. You know, so maybe I'm not a native English-speaking guy, but I feel a little bit the difference between intelligent and smart. And we talk a lot about other things, you know, smart cities and all that. So for me, the smart hospital is the hospital of the future. It's going to change a lot, you know, the way, and I think it's a big need to change that. And basically, smart hospital is about harnessing the power of those technologies we are all talking about here during the conference to deliver and to create a connected hospital to have better outcome, you know, for the patient, but also I think for the HCPs, for the people working in the hospital, for pharmacists, you know, so it's a whole ecosystem. So I think there are a lot of benefits, you know, for the smart hospitals, but I would like to highlight 3 of them. So the first one for me is improved patient care. And I think there are many people here in the room, you know, I think that's one of the key objectives. And the point is, you know, to get this connection, this connectivity, so that we all share the same information, the same data, so that, you know, the professional, doctors, nurses, pharmacists, all this data coming together, so that we can get a really informed outcome. Today, you know, and I think smart hospital is not just one building, it's not one hospital, it's connecting hospital, pharmacy, laboratory, other hospitals, so that all the data is coming together, so that the HCPs, the surgeon, whoever is dealing with that, can have a smart diagnostic, smart decision, and something coordinated with all the people, in the ecosystem. The second point, it's improved efficiency. And maybe I should put the elephant on the table. And I think in that case, maybe you should put the elephant on the surgery table and start to cut a little bit things out of that. Hospitals are we are treating hospitals like any other business. We talk about ROI, we talk about productivity. We quite often we forget the patient in that. It's about making money. So it's not only profitable, as I said, even a word I like less, we talk about lucrative business. Is the hospital the place where we should talk about those values? I think so. For me, I understand that because, a hospital might close, if you're not making money. But the key thing is to remove inefficiency in the process. There's a lot of waste in the processes. So I agree that maybe the focus should not be about making money, but if you can reduce waste, maybe there's another way to make money rather than sacrifice the patient. And the last point, of course, if all that's coming together, is to get greater patient satisfaction. Because the patient at the end, if he has a coordinated information, if all the doctors, the nurses, the pharmacists around him have a consistent message, he will be much more satisfied and he will trust much more what is coming out of that.
Thank you very much, Philippe. That's really interesting. Nina, I wondered if you wanted to pick up that point about patient satisfaction and coordination of care, given the work that MEGI does.
Yeah, I think when it comes to connecting patients with a hospital, it's zooming out a bit on that concept, because we live in a world of really chronic diseases, and from the healthcare provider's perspective, we are completely overstretched, and we are super limited with capacity, with doctors, with number of beds, financially. And what we should think about is not how to increase number of beds, but how to convert patient home and patient beds into hospital beds. So it's about introducing the concept of hospital beyond the walls of the building, of the physical facility. And this is where remote patient monitoring plays an extremely significant role. And I can talk a little bit about what we do in the clinic. Yeah. To expand on that. So clinic is specialized for cardiovascular, so it's a chronic disease, and when patient goes home, they're still, in fact, chronically ill. So how we handle that is we give them a portable device. It's a portable ECG, 12-channel device. So when they're at home, whenever they feel some symptoms, they can send this data to our hospital. 24/7, there is a telemedicine center. We read that data in real time, speak with the patient to try to understand the context, and in fact, in a couple of minutes, that person just received a cardiovascular consultation. And we have about 12,000 such consultations each year. And when you look at the outcomes of that, so this ranges from recognizing myocardial infarction, sending patient to the emergency, to advising them to take a drug or to maybe scheduling appointment next week. But this happens in about 30% cases. And in 70% of cases, patients are fine. But they did receive this confirmation, it's about reducing also their anxiety and uncertainty about their disease. But in 70%, we eliminated unnecessary hospital visits, coming back to let's increase the efficiency. So on one hand, it's reducing readmissions, but on the other hand, but when you look at it from the patient perspective, it's about just better planning the treatment by involving the patient in the whole process.
Yeah, exactly. And I think there's a real role to play in the sort of simple element of AI just being there, someone to talk to, ask a reasonable question, and then not have to escalate beyond that. Jared, we've heard a lot about what the future might look like, but from your perspective as a transformation expert, what do you think the main challenges are to sort of realizing that vision?
Yeah, so we are an association of German hospitals that want to master the challenge of digitalization together. We are currently 42 hospitals, and we are providing, on the one hand, basic classic innovation management, and on the other hand, together with partners, really doing R&D projects to create digital value and digital business models. So in Germany, I think it's pretty obvious we have medical and technological excellence. And I think Philippe already pointed out that there's a lot of potential actually attached to digitalization of healthcare. But still, in Germany, if you look at the degree of digitalization of our hospitals, we have a below average degree of digitalization. And not just if we compare us to digital frontrunners like Singapore or the US, even if we compare ourselves to our neighbors like the Netherlands or Denmark, I think it's not that great actually for us in Germany. And the question is why? And I think there are a variety of challenges we have to deal with for a German hospital in order to digital transform. Lack of interoperability, underfunding, lack of competence within our staff. So actually to really to transform the theoretical potential into the clinical reality actually is a hard task. For instance, one example, digital or AI-based OR planning, right? I think there's a lot of potential because it helps actually the planning staff to create a more efficient schedule. But if the AI is not integrated into the primary system, you have to transfer the data manually. And that creates an additional effort actually on the staff. So in terms of efficiency, it's still a question, is the digital process a more efficient workflow than the actually manual one which we used before? So I think it's possible to really transform, really create value, but it's not like plug and play. So we have to face the complexity, we have to work on the complexity, and then we have to create success stories. And then this basically my idea is that we really create something like a pull effect, that the staff within the clinic say, I want to have it because it helps me, and not I have to use it because you tell me to use it. And this is still an ongoing task, but I think there are already a lot of interesting use cases which have been able to create this value, especially if you look international. And I think even for us as a German, with all the scientific excellence, we can learn a lot from our even smaller neighbors because they are way ahead of us in terms of digital transformation.
That's really fascinating. I think I'd just like to pick up on the point as a physician that, yes, it becomes, I mean, in the US they have a term which is EHR burnout, and we aren't probably taking into account the impact on clinicians or anybody using the system, in fact, when it might give you back-end efficiencies, how much that impacts the front end. And then you talked about the OR, and all I could think about was Philippe's elephant on an operating table, so I completely missed that. Nadeem, I think that's an interesting point for you, because obviously Phlo has done a lot of digital pharmacy work, digitizing existing frameworks and infrastructure. I mean, how do you think technology will change the community hospital paradigm, and what sort of challenges have you seen in that space?
Well, fundamentally, if you look at where we are with the healthcare system, we have a rapidly aging population, a lack of staff, and a lack of resources. If you were to go and build the system from scratch, you wouldn't build it the way it's currently built, right? That's how I always look at any kind of system or process. So ultimately, we're talking about a hospital being a building. I disagree. A hospital can be in your home. A hospital can be everywhere. So the future for the community is to bring the hospital into the home using technology and actually allow those resources, those physical resources in the hospital setting to be more efficiently utilized. So how can we do that? There's some wonderful startups across the world building the technology to allow patients to be at home and be monitored with AI, then monitoring them, and the clinician then being on demand to go and talk to them. That's better for the patient, but ultimately there needs to be an ecosystem of other players to plug into that. So for example, my startup at Phlo, we're the #1 on-demand pharmacy in the UK. We actually have done some projects with hospitals so that actually they can deliver medication really, really quickly to that patient. So yeah, it's one thing monitoring the patient, but actually if they don't have access to medication or access to other healthcare aspects, that's not going to work. So I have a significant feeling that actually the paradigm of visiting that hospital that we saw over the last kind of, through our lifetimes is going to be completely different. And we're going to think about a hospital being very, very different in that future. But it doesn't work. Like I said, if, I keep getting monitored at home, but then if I'm too sick to go and get my medication, that doesn't work as a model, right? That's, so I think the efficiency aspect is really important, but there has to be an ecosystem of startups, of businesses working together to create the framework of that intelligent hospital.
Yeah, that's really interesting what you said about new frameworks and new ideas, because as you say, technology now, we have so many other options from what we've previously been doing, which actually, returning back to you, Nina, to talk a little bit about MEGI, we were talking earlier about the virtual nurse and the work that you're doing there. If you want to elaborate a bit on that, that would be really interesting.
Yeah, so coming back to remote patient monitoring, one of the biggest hurdles for us implementing these services is that it's operationally extremely difficult, and it's a huge burden on doctors and nurses who do these services. So taking in the example of the ECG monitoring we implement, we can monitor at a time about 500, 600 patients. Above that, it's just too big of a burden. But when you look at the population, the demand for this type of monitoring is huge. And we will never have enough doctors on the whole planet, to support these type of services to those patients that need that. But this is the one piece of a puzzle where AI fits incredibly well, because it's a technology that can reach precision that's high enough so that we can use it in the context of healthcare and just automate parts of that digital pathway, the delivery of these digital services. So it's all about scaling this one-on-one interaction that can be analog or digital between doctor and the patient, scale it from 1 to 1 to 1 to 10,000. And then you reach the scalability, and this we can do with the AI, enabling with the data analytics. So what we do with MEGI is a system that's communicating with patients. So she is a virtual persona, in fact, a robot that speaks with cardiovascular patients on a daily basis, and she can talk to thousands of patients simultaneously, and then connecting exactly those that need a certain attention and the clinical follow-up with the doctor. So that's like scaling this communication.
Yeah, and I think that's going to be a big part of the future. Kind of what we've intimated already, that the hospital will no longer be a bricks and mortar institution, and in fact hospital staff might not be flesh and bone people, right? Part of the system might be, in fact, digital. I just want to pick up a little bit on what you said about automation, which is something that's very close to my heart in terms of, I've just recently automated all of my productivity. So I've linked all my emails to my Trellos, and it's made such a big difference. And actually, to come back to you, Jared, we were talking a couple of weeks ago about the role of robotic process automation. And I think maybe we've got a little bit of time, so we just run down the panel a little bit and maybe talk about where you think in your specific area automation might make a huge difference in the hospital of the future.
I I think automation is very interesting because every one of us actually who already tried to change a clinical workflow see how difficult it is, right? In terms of standardization, in terms of digitalization, it's very hard to really change clinical workflows. And I think automation could be an answer because then I think we get rid of certain use cases or certain workflows, and I think it helps everyone. But the question actually, if you have automation, it's a matter of quality of data. Because an artificial intelligent robot, we need high quality of data because we have to rely on the decisions being made. And I think we are not there yet, but I think it absolutely makes sense to invest in the quality of data because then it will enable those kind of use cases. And I think what is already pretty interesting, because there we have a pretty high quality of data in terms of clinical or hospital logistics, because I think hospital logistics is still logistics. And if we look to other industries, they are far ahead of us in terms of how to improve the efficiency of logistical workflows. And especially if we can even expand it to patient transportation, because still it's still a logistical workflow. So I think there are already some workflows where I think automation can really create value, because this is not value creation for our staff, right? Bringing patient from A to B or getting the medication from the pharmacy within the hospital to the ward. I think there is a lot of potential to actually use automation, use robotics, because there's a lack of staff, I think, for every hospital around the world, actually.
Yeah, and that's super interesting. And actually, a really interesting use case for in-hospital logistics I've just seen is that Great Ormond Street, which some of you might know is a big children's hospital in the UK, used some automation software to basically develop Deliveroo, but for hospital meals for patients. So patients can just say, I'm hungry, and then it's the kitchen sends them food when they want to eat, which is pretty good, because a lot of when you're sick, your routine is all over the place. Philippe, what have you seen in your various roles in advisory boards and in pharma as well, in the role of automation and what it might offer us?
I think, the workflow discussion is something we talk a lot, and although Jared said it's difficult, I still think maybe we didn't notice the improvement that we still have. We can always do better and all that. So I think definitely, you have to automate, have workflows so that you get some things automated and you have more time for the things that cannot be automated. But I would like to add something else on this whole discussion, I think we have to wake up. The hospital is sick. And even the ecosystem, the house is burning. And we are not taking this macro level that you mentioned, to have the big picture, because I fully agree, we have to talk about things like moving the point of care so that people go to the hospital only when they have to go to the hospital. And actually, because I'm saying the house is burning, we quite often do the opposite. I'm from France, so sorry for that. Not everybody is perfect. But when you have a flu, I'm now a little bit exaggerating, but not that much. When you have a flu and you go to your doctor, to your GP, he has no time. He's overbooked, and they tell you to go to the emergency at the hospital. So you go to the emergency at the hospital for a flu, to get some, I should not to trademark, some paracetamol, So I think because of that, we are losing our brain, We are doing completely the opposite of what we should do. We are overloading an already overclocked system. So I think really we all know, we all agree, but when you go back to our work, we do the wrong thing.
Yeah, I think that interesting in saying the healthcare system is on fire. It's like we have this mantra in entrepreneurship and startups to find your hair on fire problem. And the problem with healthcare is everything's on fire. So where do you even start? And Nadeem, that's maybe a good time to come in there. Do you do much in the way of automation at Phlo, and how is that challenging?
That was the primary thesis behind Phlo, was being a highly automated, efficient business. Because pharmacists are incredible healthcare professionals, but they spend a lot of time doing process, making up medication. So pharmacy robotics isn't a new thing. They are used in hospital pharmacies. They're actually used in community pharmacies at scale as well. But where the lack of has been on the technology side in terms of systems. So my view is everything should be automated as much as possible, both on production, in terms of robotics to dispense, but also on the process around that, which then gives the clinician, so in this case a pharmacist, the time to interact with their patient. And actually, my view is that then takes pressure off general practitioners, hospital staff, etc. So there's an amazing resource with pharmacy, it just needs to be used better.
Yeah, and I think that's really interesting, isn't it? When we start to automate and give back time to clinicians, that resource compounds because you get better patient quality of care, you can see patients earlier, and actually that's exactly what we've been building, is essentially a way to see a patient without ever having to touch a computer, so I can see twice as many patients, but I can also increase the quality of every single patient interaction, and that is hugely powerful. Well, I think that was an exceptionally interesting, and I've got some, mostly from Philippe, some really disturbing mental images there, so thank you very much. And thank you very much to our panel once again and to MedTech World, and enjoy the rest of your day. Thanks so much.